All right, camera speed.
All right. This is patient testimony number 1. This is Colin. He has a full upper and lower All-On-4. Even if it had to come to taking some bone from your leg.
Yeah.
You have got one of the, out of all the stories I've done, one of the most extreme procedures that I've ever heard about.
It's been a hell of a journey, and I've already told people about it, and I've already helped others with it. Like, a woman came to me, she goes, "Oh, that's a hell of a scar." And I told her the story, and she paused. She goes, "My husband just had mouth cancer, and they took his jaw and said there was nothing they could do about it." There is. You just got to know where to go. You got to know the people. Ever since I had braces as a teenager, I don't know if it was from brushing too hard or flossing or whatnot, but over the years, after the braces came off, the gum lines receded, and it got to the point where my teeth started moving around again. I've seen, professionals over this, and they're like, "Oh yeah, your teeth move around after braces, nothing to be concerned about." Well, it was, because my teeth weren't just moving around, they started coming out. And honestly, I didn't even have a cavity when this was going on. So this was kind of shocking, to see these nice white teeth just coming out like... But anyway, after multiple partials and realizing that I need a solution to this, not just a Band-Aid over the problem, I looked into dental implants, and I did decide to go with full mouth reconstruction. They had 6 implants on the top, 4 on the bottom. The 2 were in my cheekbones, and I had those for about a year and a half. And during which that year and a half, nothing really fit right. I was constantly, severely biting my tongue, and my breathing got bad, which is odd. And one night I was sleeping, and I had jumped up and I had bit my tongue. And I bit my tongue so bad that I bit right through it. I had a hole there. And I went to the hospital to get it stitched. And when I got to the emergency room to show them my tongue, they leaned me back to look into my mouth, and they decided I was aspirating, and they intubated me almost immediately. So I was there maybe 5 minutes. Next thing you know, I am intubated, hooked up to a respirator, and in the intensive care unit. Apparently, I had developed acute respiratory distress syndrome, sepsis, and pneumonia. While I was intubated, they operated on me, and they removed all my dental implants, my teeth, everything, even all the bone it was attached to. They wake me up a month later. They're talking to me. They're like, "Hey, you were asleep for a month. Joe Biden's president now. Alex Trebek died. Oh, we had to rip all your teeth out." And I'm like, "What?" And feeling around like, wow, they really did. Come to find out, the root cause analysis was the mouth became infected, the implants became infected, the infection spread to my lungs, and that is what almost killed me. And 110 pounds after going in at 190. I couldn't walk. I couldn't really speak. It was a long recovery. And I was not prepared for that. And during that recovery, not having anything to smile, anything to talk with, anything to chew with, anything, it sucked. It was bad. It was bad. If I hadn't dealt with Dr. Kumar and his staff and his colleagues, I would have been hopeless. I would have had no teeth for the rest of my life at 40 years old and no solution to even go with it. It was insane.
I kind of felt bad. This guy, if I don't help him, that nobody's going to help him, because he's not an average case. Not average people would take interest and time to find out how this case can be brought back. So, having worked with different people, seeing different technologies, and had some experience with these kind of cases, I could know, okay, who can do this procedure, who I can refer, and who I can trust them, and who I can communicate. This is what we need. So I referred him to University of Miami.
They do surgeries where they remove people's jaws because of cancer, but then they also restore them. They came up with a solution called the fibula free flap. That's when they take your fibula bone out of your leg and recreate your jaw out of it. They rebuilt my entire upper jaw, my maxillary, ground up the rest of it, mixed it with morphogenic protein, and created like a bone graft and rebuilt my mandible, my lower jaw with it. And then came the challenging part, was designing new teeth for these new jaws. It was amazing what they did.
For the next 4 to 6 months, I was following up SKs and taking CT, how his bone is matured and other stuff. So when you do these kind of surgery, the whole mouth and soft tissue, everything changes, So our goal, okay, we know we can place the implant, but this bone is entirely different than regular jawbone because it's harder than your maxillary or top jaw. So you have to have certain type of technique to place this implant and secure those implants. I have to train myself to do this. So I'm also continuing my journey, going side by side. Okay, step 1, he's getting done. What I should be looking for certain things, because ultimately I'm the one seeing the final results, right? And he was, his previous teeth was pushing everything. So I have to open it up like this. We opened his bite and we brought all his teeth forward. Now he's comfortable, and so we can proceed.
After something that was done the first time that should have been perfect, and everything went so far south, Dr. Kumar gave me my life back. It's incredible. I would say to anyone out there who has a problem with their teeth, their gums, or whatnot, there's a solution out there. You just got to see the right people. I've seen what happens when you see the wrong people, and the results can be fatal. I promised Dr. Kumar, I said, hey, when this is over, I am going to get back to living life to the fullest. And I sure am. I definitely am. Words can't express how grateful I am. It's wonderful, and it's all thanks to here at Wickham Dental.